Hello and welcome to this comprehensive guide to the MRCS Part B examination. Whether you're just starting to think about taking this exam or you've already booked your date, this video will provide you with everything you need to know to prepare effectively and maximize your chances of success. The membership of the Royal College of Surgeons, or MRCS, examination is a critical milestone for junior surgical trainees. Part B specifically can be one of the most challenging components, and candidates often need to resit it. Since there have been recent changes to the exam format, I'll walk you through exactly what to expect and how to prepare. The MRCS Part B examination is the second and final part of the MRCS qualification, which is required for entry into higher surgical training in the UK and Ireland. Unlike Part A, which is a written paper testing theoretical knowledge, Part B is an objective structured clinical examination, or OSCE, designed to assess your clinical skills and applied knowledge in a practical setting. This exam tests the knowledge, skills, and competence expected of surgical trainees at the end of their core surgical training. It evaluates whether you can apply your knowledge in real clinical scenarios, essentially, whether you can think and act like a surgeon. Before we dive into the exam details, let's clarify who can take the MRCS Part B. First, you must have passed MRCS Part A before applying for Part B. You need a medical degree recognized by the UK General Medical Council or the Medical Council in Ireland. First-time applicants not on the registers of the GMC or the Medical Council in Ireland must submit their original medical degree certificate, or an authenticated copy. You have a maximum of 4 attempts to pass the MRCS Part B exam. Finally, you must successfully complete Part B within 7 years of passing Part A. The MRCS Part B is structured as an OSCE with 18 examined stations, each lasting 9 minutes. There's an additional minute for reading instructions before each station, and another minute for moving between stations. The stations are divided into 2 broad components that must both be passed to successfully complete the exam. The knowledge component consists of 8 stations, 3 anatomy stations, 2 pathology stations, and 3 critical care and applied surgical science stations. The skills component of the exam consists of 10 stations. These include 4 communication skills stations, which cover history-taking and information-giving. There are also 4 physical examination stations, and 2 generic surgical skills stations. It's worth noting, though, that some stations may not count toward your final marks, but these aren't revealed before the exam. The entire examination takes approximately 3.5 hours to complete. During the exam, you'll rotate through the circuit of stations. At each station, you'll find clear instructions outlining a scenario and the specific task you need to perform. This might involve examining a patient with specific symptoms, taking a focused medical history, analyzing radiological images, performing a simulated practical procedure, demonstrating surgical knowledge through spot tests on cadavers, or communicating with patients, whether simulated or real, about procedures, diagnoses, or referrals. You'll have exactly 8 minutes to complete each task, with 1 minute to move to the next station. The examiners use standardized mark sheets and also make an overall judgment of your performance, which could be pass, borderline, or fail. Remember to introduce yourself at each station, state the objective of your task, verify the patient's identity where appropriate, obtain consent before any examination, and use the alcohol-based hand gel provided before and after patient contact. Each station is worth a maximum of 20 marks, and you'll receive a separate overall rating of pass, borderline, or fail for each station. The 8 knowledge stations combine for a total of 160 possible marks, while the 10 skill stations offer a total of 180 possible marks. You must pass both the knowledge and skills components in a single sitting. Importantly, there isn't a fixed pass mark for the entire examination. Instead, the pass mark for each station is determined using a method called borderline regression methodology, which accounts for the relative difficulty of each scenario. This means the pass mark can vary between different circuits and exam sessions, ensuring fairness regardless of which specific questions you encounter. Generally, you need to pass roughly 70% of the stations in both knowledge and skills sections. This means you can fail 1 or 2 stations in each section and still pass the overall exam, provided your total score meets the threshold. While the Royal College of Surgeons suggests sitting the Part B exam in core surgical training year 2, Research published in the BMJ in 2017 showed that pass rates were actually highest for candidates who took the exam during CST1. Many trainees choose to sit it earlier than CST2 to focus on surgical specialty job interviews in their second year. From the data, around 70% of candidates pass at each sitting. That concludes Part 1 of our guide to the MRCS Part B examination. We've covered what the exam is, who can take it, how it's structured, scored, and the optimal timing for sitting it. In Part 2, we'll dive into preparation strategies, common mistakes to avoid, exam day tips, and what to do if you don't pass on your first attempt. Make sure to watch the second part for these crucial insights that will help maximize your chances of success. Thank you for watching Part 1. If you found this information helpful, please like this video and subscribe to our channel for more MRCS guidance. See you in Part 2.